Hi, I'm Tara Labenz,
And I'm Labenz Novacek.
and we chose the Brief Inventory of Communication and Cognition, and it's abbreviated the BURNS. All right, so some important facts about it. The origin of it is in the United States. It was published in 1997 by Martha S. Burns, who is a certified speech-language pathologist. You can purchase it at pearsonclinical.com or psychcorp.com. The age range is from 18 years, 0 months to 80 years, 11 months, so that's quite the range. And then the administration time is typically 30 minutes per inventory.
So the purpose of the BURNS is to assist the clinician in determining which communication and or cognitive skills are impaired and help select appropriate treatment targets and goals. So the BURNS assesses 3 areas: the left hemisphere, right hemisphere, and the complex neuropathology.
All right, so the left hemisphere inventory, it assesses receptive and expressive oral and written language skills that typically are impaired after focal lesions to the left hemisphere. And it has a few subtests, and those include auditory comprehension, verbal expression, reading, writing, and numerical reasoning.
So the components within the LHI are auditory comprehension, which includes answering yes/no questions, comprehension of words and sentences, as well as paragraphs. The verbal expression portion looks at automatic speech, verbal repetition, responsive naming, and confrontational naming. And the reading portion looks at oral reading of words and sentences, reading comprehension of words and sentences, as well as functional paragraphs. The writing portion looks at writing to dictation and functional writing tasks. And lastly, the numerical reasoning looks at identifying time, money, and then calculating how much money you would need to buy various items.
All right, so the right hemisphere inventory, it assesses attention, visuospatial perception and construction, and then communicative skills commonly affected by focal lesions to the right cerebral hemisphere. It has 4 subtests, and that includes, it looks at scanning and tracking, the visuospatial skills, prosody, and then abstract language. So it's a little shorter than the left hemisphere inventory.
And lastly, the complex neuropathology inventory assesses attention and memory components of cognition associated with deep cerebral lesions. So the areas that it looks at are orientation and factual memory, auditory attention and factual memory, visual attention and attention and memory, as well as visual perception.
All right, so scoring. So it's a criterion reference test, and there are 3 levels of scoring, and those include, so for an individual to get a 2 on their assessment, they have to independently answer both questions of the task correctly through verbal, gestural, or augmentative system responses. For a 1, they need to answer both questions of the task correctly, but with assistance from the clinician. And then a score of 0, the client answers 1 or both of the questions of the task incorrectly, or the client does not respond to 1 or both of the questions. So any reliable yes/no response is accepted and is counted as correct. So that would include, the gestures, the head nods, eye blinking, or using their device. And these responses are not considered assisted since they did it independently. And the client must answer both questions of the task correctly with reliable communicative intent in order to earn those 2 points.
So just some general additional information. The BURNS does not include basilar ceilings within the assessment, so the clinician should administer each subtest completely. And within each area, in each of these subtests, they're fairly short, so we assume that's why there's no basilar ceilings. If all 3 of these inventories are administered, it's considered a comprehensive assessment, but if only 1 inventory is administered, it's just considered a specific subject area assessment.
All right, so some strengths and weaknesses. The strengths, it's pretty quick to administer. It's pretty easy to score. The inventories can be administered in isolation or a combination based on the client's needs and their brain lesions. Some weaknesses, it's pretty outdated. and the stimulus cards and visuals aren't connected, so you have these large cards and there's a bunch of them and they're just free floating. So you have to make sure you have all of them and in the correct order that you're needing. So the clinician has a lot of sifting through the materials to do while administering it, whereas typical assessments, they're at least have some kind of binding to them, so that way the clinician doesn't have to worry about losing anything.
And these are our references.